Bell's palsy is a condition in which the muscles of face, the facial muscles, are involved. It seems to be drooping because of the weakness of these muscle fibers. So, the main symptoms are this drooping of the face. It mostly affects only one side of the face. So, muscles of one side of the face will be seen to be drooping, and the lips will be deviating to that side, and there will be another main symptom, that is unable to close the eyelids. So, it will be kept opened, difficult to close. Then there will be sometimes difficulty in chewing and spitting. That type of symptoms also are associated with the Bell's palsy. Mainly the reason is it is found to be some defect in the facial nerve. Facial nerve is the sixth cranial nerve which supplies the structures of the face also, that is the eye, nose and cheek, chin, gum, etc. So, if there is any defect or any pathology to this nerve, all these structures will be affected. So, being a facial nerve not deformity but disease, actually it is said to be an inflammation of this nerve, maybe infection. That type, in such a condition, these structures which is supplied by this nerve will be affected in a way or another. That is what is meant by Bell's palsy. Now, usually in early stage or in initial stage, it is not a serious condition. It can be treated easily. Only if it is persisting for a long time or become chronic, these symptoms become serious, and later this difficulty to bring it back will be little tough. Now, according to Ayurvedic theory, this nerve problem is due to Vata Vishesha. So, there are so many properties for this element Vata, and main among them are Chala. Chala means movement. Any movement is due to the property of Vata. And also one property is Shida. Shida means keep it cold or cool. So, that property also belongs to Vata. And then, if there is any Visheshan or any increase or decrease into these properties, there is possibility of Visheshan of Vata. These two are involved in the development of Bell's palsy. So, since the movement is affected, the movement of these structures is being defective. And then we can understand one more thing, since Vata is the vitiated factor there, any condition or any situation where this cool atmosphere or cold items are more, then the probability of developing Bell's palsy is more. Exposure to cold atmosphere or exposure to cold winds or taking too much cold items, these are all bringing possibility of this development of this particular disease. Now, coming to the treatment aspect, we have already seen that Vata is a main factor in this. So, we have to control or we have to bring back the normal functioning and normal properties of Vata. Then only the management is possible. And one more thing, we know the facial nerve is one among the 12 nerves of the CNS, central nervous system, and it is starting from the brainstem. So, for the treatment of this condition, we have to do something for the improvement or the normalization of this CNS, not CNS as such, but facial nerve. So, the treatment also should be focused on this head region. So, there are two steps, two fractions for the treatment of this particular condition. One is local normalization of the Vata. Second is the root cause, to bring back to normal the root cause, that is facial nerve. That treatment will be focused in the head region. And to side by side for these two sections, oral medications are necessary. So there are so many medicines, so many treatment procedures to achieve this goal. Facial massage, that is very scientific way, otherwise it will be, if it is wrong way, the problem will increase. So the correct type of or scientific method of facial massages and these external applications, and scientific method of gargling, that is known as gandusham or kabalam, like that, that is highly effective in this for the treatment of this particular condition. And these are the localized treatments. And for the treatment of facial nerve, strengthening of the facial nerve, or to decrease the pathology of the facial nerve, the treatments on the head region is very important. These are mainly Shirovasti, Shirodhara or Shirolebanam, etc. And by a combined action of these two, we will get good result in the treatment of Bell's palsy. And one particular symptom, it is already said, is difficulty to close the eyelids. In many cases, by the treatment of these two things, that is the localized treatment and also the head related treatments, that will be controlled. But if their eyes are already weak or more strainful, then that will be existing little more. Then we have to do some extra treatments for this for the cure of this particular symptom. For that, we have to select other treatment procedures also, such as peculiar characteristic treatment procedures for eye disease, that is netra tarpanam or netra segam, like that. That will solve this problem. So in general, we can say the Bell's palsy cannot be treated by a single drug. We have to focus two things. One is the facial muscles which are affected. Second is the problem of facial nerve, which is the root cause. By managing these two things together or side by side, we will get a good result. There is another highly effective method in the treatment of this Bell's palsy, that is Nasyam. Nasyam means scientific mode of application through nasal cavity, through nostrils. And for that, there is a preparation of the patient, just like massage of the head and then fomentation, like that. That procedure is very scientific way. And after Nasyam also, we have to take care, after procedure methods also are to be followed. That also will give strength. It is a strengthening method to the nerves and the muscles of the head region. So that is very highly effective treatment method in the treatment of this particular condition, Bell's palsy.